Hi everyone, thank you all so much for taking the time to watch this video. My name is Lily Turner and I am working with Doctors Cottle and Glass this semester to do a little research on oral pathology lesions in the pediatric population. So today's agenda, we're going to talk about the team, discuss the project, talk about what we're documenting, filling out the Axiom form, and then giving some examples. So first of all, let's meet the team. So I'm Lily, I'm a rising D3. This is just something that I'm incredibly passionate about and feel that there's a huge gap in knowledge. So I came up with this idea. Dr. Caudill is my PI and mentor, and she went ahead and said, let's do it. And Dr. Glass of the pathology department is absolutely instrumental in helping us do this. So with that being said, what's this all about? So I have a huge passion for peds and oral pathology. And during my research, I just realized that there was not a huge overlap between the two. There's a little bit of information here and there, but it is not all encompassing. So I really found that this is a critical barrier in the field of pediatrics that needs to be addressed through advancing education and training. So in our study, we're going to be documenting oral and maxillofacial pathology lesions that we see in the pediatric population. So all in all, this is going to be probably about an 18-month study with about 140 unique lesions. So what I mean by unique lesions is if a patient comes in 1 week and they have an aphthous ulcer, and then they come back 3 weeks from now and they still have that ulcer, I am not going to be including that twice in my research. So some of the benefits of this research is really improving the health and outcomes of pediatric populations, ensuring age-appropriate care and treatment options. Public health awareness is a huge one, training of future healthcare professionals like myself, determining the nuances between similar oral and maxillofacial lesions, and interprofessional collaboration. We're going to be working with a lot of departments. So this research has been approved by VCU's Institutional Review Board, also known as IRB, and it has been accepted for an A.D. Williams grant pending completion. So what's going to be documented? Everything you come across. Honestly, I promise it will not be that bad. So this includes things that you see probably every day in clinic, including geographic tongue, aphthous ulcers, mandibular maxillotori or exostosis, leukoplakia, the 3 Ps, amalgam tattoos, lichen planus, etc. If it isn't the norm or is a variation of normal that isn't seen in the majority of the patients, please document it. So when in doubt, you're going to document it. This is crucial to getting a non-biased, all-encompassing database to work with. So if you document it and we decide that it doesn't need to be included, that's okay, but we would rather over-document than under. So how are we going to be kind of keeping track of all of this? We're going to be using an Axiom form. So we've created a form in Axiom that you'll quickly fill out if you see something that's an oral maxillofacial lesion or it's a variation of normal. So this is what it looks like. We use the 09 pediatric recall or new patient form for every patient that we see in the peds clinic. It is now included in it. So that bright red line that says oral pathology / variation normal, you will fill that out every time. And this is kind of just getting into the nitty-gritty of the form a little bit. The first question is going to ask you if it's soft tissue or osseous. So you can determine that by, did you see the lesion in the face, in the mouth, or was it seen radiographically or on the teeth? Next question is going to talk about localized versus diffuse. So is the lesion more spread out, or is it just one compact lesion? And then the third question is going to be a fill in the blank. So if it's a localized lesion, because you can't really, measure a diffuse lesion as well, but if it's localized, you're going to put in X millimeters by X millimeters by X millimeters. So the width, the height, and the depth, just use a perio probe. Next one's going to talk about color, and it's going to be a check all that apply because some lesions really show up as multiple colors. So we really included the majority of colors here: red, white, pink, blue, purple, yellow, black, or brown. That's pretty standard. How does it feel when you push on it? That's for soft tissue only. Is it squishy or unforgiving? Next up is the relationship to the surrounding structures. So I have here some images talking about displacement, expansion, and root resorption. So this gives you a little bit of an idea of what I mean with each of those, and you will have access to this PowerPoint. I'll be emailing it to you, I'll be sending it to you. So if you ever have any questions, please do not hesitate to review this or reach out to me. Next up is surface texture. So is the surface smooth? Is it irregular, or is it wipeable? So all the surface textures are down in the bottom right hand of the screen. So that gives you a little bit more information on things that we're looking for. Next one is the primary morphology, and again, this is only for soft tissue. So is it exophytic, which means sitting on top of the surface? Is it endophytic, which means it's kind of into the surface, like a fissure or an erosion? Or is it flat? Flat, just like a little, macule, a patch, yeah, anything like that, a freckle. And then if it's intraosseous, we're going to have radiographic appearance. So radiolucent versus radioopaque, mixed density, or if it's a tooth anomaly, that doesn't really fit in anywhere. Then the last question is going to kind of make you think a little bit. So I will be categorizing all these lesions into one of these kind of buckets. So we have the vitamin C bucket, which is vascular, infectious, traumatic, autoimmune, metabolic, idiopathic, neoplastic, or congenital. And then here's kind of what I mean when I say, is a lesion vascular or is a lesion metabolic? So this kind of gives us a little bit more of a narrowing down so we can tell where these lesions are coming from or what's the cause of them. So you're going to fill out what you think it is. And if you have no idea, you can either leave it blank or take your best guess, because I will be going back over, like I said, and just reviewing all of this at the end. So photographs. This is going to be, aside from filling out the axiom form, this is absolute key. So photographing all lesions is an absolute requirement. I will be the person that is responsible for uploading all the photographs into the chart. So all you have to do is take a photo of the lesion that you see and a photo of the patient's chart number, and then I'll take care of the rest. So when you get this, you can go ahead and use your phone and scan the QR code, and it gives you a little bit of kind of tips for if you're not sure how to get a photo of something. Little bit of tips, little bit of tricks, and then here's some problem solving. So often things come out too dark or too bright. The camera that we will be providing is going to be a fixed setting camera, so you will not have to change anything. Just probably focusing, but here's some troubleshooting just in case. So time to play, should I document this? You don't necessarily need to know what everything is. Hopefully you do, but if you don't, it's no big deal. When in doubt, we're going to document it. So here we have a radiographic lesion. You're going to document that. So what you're going to do is you're going to take a picture of the x-ray and then a picture of the chart number. So next up, we have some maxillary toritis, some exostosis. You're going to take a picture of it. You're going to take a picture of this, and you're going to take a picture of the patient's chart number. What about something like this, like hairy tongue, got some candidiasis, anything like this, you're going to document. It is not normal. We also have something like this, kind of an exophytic mass. Maybe it's a fibroid mass, maybe it's something else. You're going to document it. It's not seen in the normal population. We also have things like macules or papules, like nevuses. Those are not normal, and we want to make sure that we are documenting them. Finally, we have some aphthous ulcers, some frictional ulcers, things like that. Unfortunately, that's not considered normal, and that is considered pathology. So I am requesting that we go ahead and take a picture of the lesion and take a picture of the chart number. Geographic tongue, not normal. We're going to take a picture of it. So if you're still curious about this project, why I'm doing it, you can scan this QR code and read my A.D. Williams application. So it really goes into depth on why I'm interested in this research, why I wanted to do it in the first place. Questions, feel free to email me. I will be sending this out to all of the faculty, the residents, and the students that are on rotation. So if you guys have any questions, just let me know. Thanks so much.